Well, there for a while I was really worried right after my heart attack. I didn't think I'd ever get back to work. I was feeling discouraged and depressed.
Mr. Cummins' reaction is a very common one shared by hundreds of other victims of heart disease. After medical or surgical treatment, the person who has been hospitalized for heart trouble is faced with the overwhelming reality of sorting out his new limitations and capabilities. Families of these patients have dozens of questions that need answering and educated professional help in planning lifestyle changes. Kettering Medical Center has developed a program called Cardiac Reconditioning. Dr. William Cassel is the director.
Cardiac reconditioning is an outpatient service designed to improve a patient's tolerance to exercise following a heart problem. We've found that many patients, when they leave the hospital, have real fears about how much activity they can participate in at the time they leave the hospital. The aim of this program is to allow the patient to obtain their maximum degree of physical activity that is consistent with safety to the patient. After a patient's had a heart attack, we usually wait about 12 weeks before we enter them in this program. If they've had cardiac surgery, we usually wait about 6 to 8 weeks following their operation.
Program. Does insurance help pick up the cost? How can a person get started in reconditioning classes? Well, for the answers to these questions, let's talk with Harve Walker about the program.
For coverage of the reconditioning program, policies differ. Now, all insurance will cover the stress test. A patient is charged $19 per treatment and pays according to the type of insurance. As an example, Blue Cross with Major Medical will cover 80% of the treatment. That leaves a balance of $2 to $4 per treatment for the patient to pay. Medicaid welfare will cover the patient totally. All the patient need do is secure the necessary approval from the agency. Regular commercial insurance will also cover 80% of the total cost, if that company is listed under those that will honor such claims. My advice is to contact your agent, have him check your policy, and work it out.
But who can qualify? How can a person get started in the classes? The key to entering the program is your own physician. It is the patient's doctor who refers the patient to the program by verbal or written orders. A medical history and pertinent information concerning the patient is obtained by the reconditioning department. Before the program of exercise is initiated, a stress test is performed during the first visit. Present to observe the patient and study the results. From the results, a prescription for exercise is written. Cardiac monitoring is carried out during the exercise. The amount of work is gradually increased as the patient tolerates it. Progress notes are sent to the physician periodically or when specific changes have been noted on the monitor. Exercise guidelines written for home instruction are given to the patient in order for the patient to maintain a good exercise tolerance. These guidelines, along with a discharge summary, are written to the attending physician when the patient has received the full benefit of the exercise program. A follow-up stress test is designed to assist the patient and medical staff as to his increase in tolerance and exercise level. One benefit of the program is that the patient gains confidence in his knowledge of the amount of work he can tolerate at home.
Well, right from the very first, I thought, exercise? Isn't that a little risky? Or could give me a problem in doing this at home after having a recent heart attack? But the instructors told me, after explaining what I'd had and what damage I'd done to my heart, how the exercise could help me in strengthening my heart, and hopefully I can return to the full responsibilities and get back to my job as soon as possible.
Along with the educational classes are held using videotapes, written materials, and nurse instructors holding question and answer periods to which families are also welcome to attend. The registered nurse supervisor involved in implementing the program has not only worked with cardiac patients for 8 years, But as the wife of a man with heart disease, she can empathize and give valuable first-hand tips on common obstacles the cardiac patient must hurdle. Jean Shearer comments.
Patients enter our program quite sobered by their research and the knowledge that changes need to be made in their everyday life. Depression is common in patients after heart attack and open heart surgery. We've noticed a change in our patients' attitudes from the point of initiation. Somehow getting back into an exercise program lifts that depression and restores that spark of hope and zest for living they had temporarily lost.
The instruction is given us to ensure that all important information is heard and understood. There is also that bond of camaraderie that develops when others are working toward the same goal. It is somehow encouraging to be with other class members who have gone through the same thing you have, particularly for the other members of the family. Once everyone accepts that there will be changes, progress can be made.
You know, the biggest change I made was a change in my diet, and it was a change for the better. I feel healthier now than I have in years, and my wife does too. What it really amounts to is just plain good sense about eating.
Should a patient have specific questions concerning his diet, a call goes in to Claudia Steele, the registered dietitian who is specialized in the nutrition of the cardiac patient. She is ready to help define the patient's problem and search out the answer.
After I had my heart surgery, I was looking for a program because I wasn't doing very well. So I called Jean Shearer and I got on this program down here. I couldn't even walk from my house to the road or the mailbox without getting angina. So I came down here and proceeded on the program. At the beginning I started, and just in the warm-up I had angina, just in the first 2 minutes. And then after being on the program for a period of time, then I got to where I could walk extensively for 5.5, 6 miles an hour, and walk even as long as 8 minutes in the warm-up, 12 minutes. And then now I walk every night. I walk about 3 miles, and I walk for about 45 minutes every night. And it's really done a great deal of good for me.
I think one of the things that this program has done for me is I was laying in bed, flat on my back. I was wondering, well, what can I do? Am I still going to be able to function? Am I going to be able to work? And I think this program has given me the confidence that I can still go out, do a good job, and survive in a workaday world. And when you're laying in bed, I think this is the one thing psychologically that plays havoc with you, is you really don't know after your heart attack what you can do. And this program has helped me to put confidence in my own well-being and my own health.
As a step toward maximum recovery, cardiac reconditioning offers the personnel, equipment, and careful plan to initiate a positive program of progress for the post-coronary patient. If you're interested and want more information, just call Kettering Hospital and ask for the Cardiac Reconditioning Department. Phone 298-4331, extension 5410, or ask your physician about enrollment.